Hello. This is going to be my first video after the approval of my surgery. I haven't updated anything on YouTube. I'm hoping that I'll be able to edit it somehow and load it up into my YouTube channel. It is August 13th, 2012. I've just completed my 5-day pre-op diet. I am soon to be banded. Tomorrow is the surgery. I'm scheduled for 9 a.m. She operates 4 patients tomorrow. I'll be the 4th. Yeah, well, this is me. I don't have a scale, so I'm not able to weigh myself. I really haven't lost much weight since I began the liquid diet. I think mainly because, I'm going to admit this, the day that I was given the final okay, to make a long story short, my surgeon asks for you to reach a certain goal weight. Once I reached that goal weight, I hadn't eaten in 3 days to try to get to that goal weight, which was 225 pounds. And it was because they changed my appointment, so I was counting with 3 days less than what I normally thought I would have to go into that final weigh-in, which is very difficult for me, to 225. So I practically didn't eat for 3 days, got on the surgeon scale, weighed the 224.4, left the office. I knew the next day I would have to start the liquid diet because for her it's the 5 days prior to the surgery, and she was giving me the date for the 14th. So I went and I ate a big turkey without mayo, but it was still a turkey sandwich with bread, which was a no-no. She didn't allow, my surgeon doesn't allow for a month prior to the surgery to have that amount of bread. She also cuts out chocolate. You can't have chocolate, you cannot have carbonated drinks, you can't have onions or garlic, any sort of oils, no citric, like oranges, none of that, not that kind of fruit. So it's a little bit restrictive, and it's for a month prior. So what I did is I ate that big turkey sandwich, and also later on that day I went to a Chinese food place that makes Puerto Rican style Chinese food, and I ate one of my favorite Puerto Rican foods, which is mofongo. It's fried plantain mushed together, very high calorie, fatty, but delicious. Anyway, so I ate that, and I think that because I had such a, prior to starting my liquid diet and being 3 days practically without eating anything but broth to try to make the weight, that might have thrown off whatever weight loss I would have had. And I think that's why the scale hasn't moved much, because I have been very, very good on my pre-op 5-day pre-op diet. I've been very loyal to it, very disciplined about it. Anyway, so my current weight is unknown. I think it's anywhere between 225 to 227, 8, I'd like to say. I'm going to see if I have an opportunity tomorrow to weigh myself somewhere in that hospital before going to the OR. But I'm all packed. What I'm going to do is a little bit of a video after the fact, which it's not too cool, but I'm going to do it so you can see what I drank and what I ate during that 5-day pre-op liquid diet. I'll just show you the paper that I have. Every surgeon is different. Just follow whatever your surgeon is telling you to do. Okay, so now I'm going to get up so you could see me today. So I could see me today. I'm not excited. I'm not sad. I'm kind of wondering, since I've never been much of a, my motivation for weight loss and getting the Lapband is because I'm sick of being overweight, fat, obese, whatever, fat girl. I want to feel comfortable in my clothing, and I want to get rid of this diabetes medication I take, which is metformin, which gives me the runs every day. And I've also developed high blood pressure. That's my main motivator. But maybe because I've been overweight most of my life, I'm not a big shopper. I don't get excited about going to see clothes. I'm wondering if it's gonna be, I'll be able to compensate my pleasure, the pleasure that I would get out of eating what I wanted, how much I wanted at whatever time I wanted, replacing that with the NSVs related to appearance. I'm wondering if that's gonna be on equal ground for me. I think so. You know, who doesn't like to look good and lose weight and, you know, be able to wear normal clothing? Right now I'm at a 22. That's the biggest I've run up to, is 22, with some 3X sizes on shirts because I'm top heavy. I'm well around in the center. And right now I'm at a 22, loose fitting 22. But I don't even remember ever being, I don't ever remember being a 12 or 14. Maybe I got to 100 pounds when I was in 3rd grade, and I was 7 in 3rd grade. So you can imagine how long I've had the issue with being obese. I lost weight when I was in high school, grade school and into high school. I went down to 109 was my lowest, and then 129, but that was during high school and grade school. So anyway, I'm going to get up now. Right now I'm in the hotel room where I'll be driving from to pick up my mom, who will accompany me to go to the hospital. In Puerto Rico, where I'm at, the operation is not an outpatient. They don't give you that option. There's only one surgeon performing it in Puerto Rico. Her name is Dr. Ana Santos. She's supposed to be excellent. She is excellent. Tiny too. I have no idea. I asked her, how do you operate on people? I think she's maybe 5'3", and if she weighs 100 pounds, maybe 110 pounds, it's a lot. And she's very petite. But anyway, she tells me she has different benches, and depending on how big the patient is, you know, they're higher or lower. But anyway, so I have to stay overnight over there. So I'll be checking in, I guess, back when I come out of surgery, God willing, and Dr. Santos will. Okay, so I'm gonna get up now so you can see me. No makeup on, my hair is all in a mess, but I just want to get a good view of. You can see the Jello. That's the Jello I was supposed to eat, but can't have any more after 8. That's another rule she has. Nothing after 8 p.m. Okay, so let me just see this. Okay, this is me. This is my girth here. This is the side. This is the back. The jeans are kind of a little big, but not by a lot. Okay. I'm even going to do this for me. I'm going to show my abdomen. You see that? It's kind of ugly. That's the abdomen. Have you seen a live show of abdomen? Look at that. And then from the side, you see how this kind of hangs. It's like, you know, all of that. See that? Anyway, that's what I want to get rid of. So, that's it. Hopefully I will be giving an update soon. I have received all of those recommendations on walk right away. And I'm going to try to do that. I've never been operated on. The most I've had is maybe some stitches here on my finger. So, see how it goes. See you soon. Logging off. I think I chose my nickname to be Mary Had a Little Lap. So, Mary Had a Little Lap. Soon. Bye-bye.